we have all of our media friends joining us, and want to thank everyone for joining us. I'm Paul Baltus. I'm speaking on behalf of a number of health systems here, and I'm glad to be able to introduce chief medical officers from those health systems. For the benefit of the news media, I'm going to put up on the screen here the names of the chief medical officers. You'll see their names displayed as well as they're speaking. But I thought for the benefit of everybody who's watching and taking notes, these are the names of our CMOs who are participating. I also wanted to take a moment to just read a statement that was shared publicly about an hour ago, and kind of restate the reason why we're here, and then we'll turn it over for questions. So the statement reads, to ensure the safety of our patients, employees, and communities, several of Nebraska's leading health systems will require all employees to be vaccinated against COVID-19. The COVID-19 vaccine is safe and effective at protecting against serious infection and hospitalization. More than 125 professional health associations and healthcare systems are calling for mandatory vaccination of healthcare professionals. Unvaccinated employees and physicians may apply to their employer for medical or religious exemption. Each of our organizations take very seriously the responsibility of providing healthcare to people of all ages and backgrounds in our communities. Vaccination against COVID-19 is an important step to stop the pandemic and allow our teams to work in the safest way possible. We strongly encourage vaccination for all eligible individuals in our community. So with that, members of the media, we'd like to open it up for questions, and members of our CMO panel will answer in turn. So please feel free to begin asking questions. If you prefer to use the chat, go ahead, but I'll leave it up to you to go in order and do as best as you can to not speak over each other. So please go ahead, colleagues.
Hi, Waverly here from KTV. Can everyone hear me okay?
Yes.
Okay, great. So I just wanted to go over if everyone, or maybe if there's a list of like how many employees are we talking about that are already vaccinated versus how many that are not, and like are these like just medical staff, are they custodians, people who work in like the dining halls? Can you just kind of go over that information?
Sure, and I'd be happy to kick that off. Before answering that question, I'd like to make one introductory comment, if I could. You know, I've been a proud Nebraskan my entire life, and I think to quote one of my colleagues, Dr. Chris Maloney, the pandemic has really served to bring forth a silver lining, or the silver lining in the pandemic is that we've all come together as chief medical officers and leaders of our health systems for the betterment of the community. And I think today, this joint statement really highlights the pride that I feel and that I believe my colleagues feel as well. This is very unique. I've not heard of other communities having done this. And I think it speaks to the commitment that we all have as competitor health systems who want to do the best for our community and do it together. And I think that should resonate loudly with not only all of you on this call today, but also the members of our communities and the populations that we serve. So thanks for letting me make that comment. To answer your question, in Nebraska Medicine, we have roughly 80 to 85% of our workforce vaccinated. There's the remainder, 15 to 17%, that we either know are unvaccinated or have not disclosed their vaccination status. And that's inclusive of all workers, whether they be nurses, other ancillary care providers, environmental staff workers, et cetera.
I can answer for Bryan Health. Bryan Health, our employee population's at 85% vaccination rate. And really, when you ask who's not vaccinated, I would say it crosses the spectrum, and for a variety of different reasons. So we still have different types of staff, whether it's nursing, environmental services, registration, a number of different staff that may not be vaccinated, again, for a variety of reasons. We actually took a poll to ask those reasons. Some of these were just concerns with vaccine safety, personal preferences, concerns for untoward effects or reactions. So a variety of different reasons why.
Speaking for Methodist Hospital, I would say we are approaching the 80% vaccination range. I think of great importance is the fact that over 90% of our doctors are vaccinated, which speaks to the overall feeling of the physicians in this institution that vaccination is the way to go.
Yeah, and I would echo from Children's. This is Chris Maloney. We also are approaching the 80% mark, and it crosses all spectrums inside of our organization. And as Dr. Blatchford discussed, our physicians, both our primary care physicians and our specialty care, are well over 97%. And likely that number will increase as well going forward. It should also be noted that the vaccine is very safe. The reason it hasn't gone through FDA approval is more around supply chain and storage and how do you get it to people rather than the safety and efficacy of the vaccine.
Terry Ward with CHI Health. Yeah, along the same lines as everybody else. I think we all have about the same vaccination rates for our physicians and our nurses. Yeah, I do want to quickly echo Dr. Frankel's comments. I remember our first outbreak in Nebraska was in Grand Island, and we had just overwhelming numbers of patients, and so many people on this call and on these screens took those patients for us and helped share the burden of all this. And that was just the beginning of this collaboration together, where we have been meeting together almost weekly to talk about testing, vaccination, policies about visitors, policies about elective surgery. We have done so many things together. And this is just one more great example of everybody working together. We have about 11,000 employees across our hospitals. And so we still have, it's going to impact a lot of people, but that's currently similar rates. We will require vaccination for everyone who comes in contact with our patients in our hospitals. So doctors, all staff, even vendors that come in the hospital.
Could one or more of you, oh, I'm sorry, go ahead, sir.
This is Don Schmidt from Madonna. We have about 2,100 employees. Currently, we're sitting right at 80%. But on a positive note, we've really seen an increase, a measurable increase over the last month in the voluntary vaccination. This will include everyone. We did announce this to our staff late yesterday afternoon. And on a very positive note, the feedback we've received thus far is very positive. There's overall essentially a collective sense of relief that is coming in that feedback.
A couple quick questions. One is, I'm wondering what the legal standing is. I'm sure your counsel, your attorneys have looked into it, what the legal standing is on mandatory vaccinations in Nebraska. And number two, what are the implications for an employee who still declines to get vaccinated?
So this is Chris from Children's. Of course, we always bring our legal counsel in, and sometimes we consult external counsel as well. This has been attempted in many other organizations across the country. There have been legal suits brought against organizations, and none of them have brought merit. And so we feel, and this is why we're going as a group, we felt it's very, very important that as the healthcare systems in Nebraska, that we do this as a group, because we want to make sure that not just one person is getting out ahead or behind. As you've heard, we have been doing things in combination with all of the systems since the middle of March of 2020. And this is just another example. This one may be a little bit more prominent because for some reason a vaccination and a mask have become political. They're not. It's all about healthcare. And remember, at Children's Hospital and Medical Center, the majority of our inpatients are not even eligible for a vaccine because they're less than 12 years of age.
I wanted to share a question that came in through the chat. And this is about hospital capacity with growing numbers of COVID across the state. Is there concern amongst the chief medical officers and the systems in which they serve about impacts on capacity?
Sure, Paul, I'd be happy to address that. This is Harris Frankel of Nebraska Medicine. You know, it's interesting. We all experienced a surge beginning last spring related to COVID, and we had to do a number of things to create capacity, including reducing and in some cases eliminating elective procedures. We had to move staff around, those who may have been working in the ambulatory environment, move them to the inpatient environment. And as the surge that we experienced in the spring began to wane and the number of COVID patients in our facilities decreased, our capacity did not drop commensurate with the drop in COVID patients. In fact, as we progressed throughout 2020 and into 2021, there are a number of individuals, as you can imagine, who deferred and or delayed necessary care because of the pandemic. As the number of COVID hospitalizations dropped, those beds became occupied by patients who had put off care or who deferred necessary care earlier. And so our system, as I believe all the others, have remained quite full and at or near capacity for many, many months now. We are having to retool our operational plans in response to the most recent surge related to the Delta variant. We are dusting off some of the operational plans and policies that we had in effect earlier this year and that had been developed early on in the pandemic to accommodate the surge we are seeing. And but as health systems, we've proven one thing, that we are able to manage from an operational standpoint. As Dr. Ward pointed out, we have worked collectively to share the burden of COVID patients. And we recognize that some institutions are able to provide certain types of care that others aren't. And we've been able to serve as a partner to our outstate community and critical access hospitals who have needed many of our tertiary and or quaternary services and been able to take those patients when it was appropriate to do so, in that we were able to offer necessary care to them that could not be provided otherwise. It's a challenge operationally, but we've got great people who have gained experience over time in being able to manage, and we feel confident that we will be able to manage going forward whatever the surge might present.
So
Hi,
at Children's Hospital Medical Center, one of the things that we've seen is an increase over the last month or 6 weeks in what is normally called respiratory viruses, the winter respiratory viruses. We saw this actually happening in December and January in the Southern Hemisphere. And so we expected that it could happen in North America, and it has. It's not just unique to Omaha and Nebraska, it's across the country. As far as the COVID admissions though, we've consistently had less than 5. I think today it's 2. When the public health emergency was lifted, the ability to share data became much more difficult. And we're no mind sharing data. We're pretty full as well with other respiratory viruses, not with COVID. However, we do know that many places in the South states, Arkansas Children's Hospital, in Texas, in Louisiana, in Florida, they are filling up with COVID patients. They're having COVID admissions like they've never seen before. And we anticipate that will happen if we don't employ the non-pharmaceutical interventions such as masking and social distancing, keeping our hands clean. That's what's going to be important in order to limit the spread of this crazy Delta variant.
Could you
I would
comment?
Go ahead. I would add in that we are running very full 97, 98% capacity with medical patients, surgical patients. The ICUs are full as of this morning. We have 3 ICU beds open. So yes, we're worried about having to accommodate a surge.
Doctors, could you talk a little bit about, you mentioned this, Dr. Maloney, a little bit, but we're hearing from doctors, and obviously social media always amplifies this, that med surg and step down beds for children, pediatric beds, are really hard to come by in Nebraska right now. And this with kids just starting back to school and with this Delta variant. What are you seeing in the last week or so? And how realistic is what's being spread that folks are being turned away, that sort of thing?
Well, as I've mentioned, we have had an increase in the winter viruses, respiratory syncytial virus or RSV being the most common that we see. And what's great about our organization is that at the end of the month, we get to open our Hubbard Center for Children. So we're going to increase by 80 beds. Now, with that being said, it's still a staffing issue. We work with all of the hospitals in our area as well as others outside of our area to find locations where we can hospitalize patients, working very closely with Nebraska Medicine, with Bergen Mercy in order to transfer for patients as they're needed if we're getting full. So we still have beds. We really don't want to surge in COVID, that's for sure.
In the statement, it was mentioned that each system will have a policy for exemptions and employees wishing to be granted a waiver. Wonder if you could expand a little bit about the requirements on those. Maybe Dr. Doran, we can start with you and Dr. Ward chime in as well.
Yeah, I think each institution is going to develop their internal policies on how to look at exemptions and then what the consequences might be for that. I think some of those policies are yet to be determined and yet in development, but ultimately there will be some sort of either restriction on how someone can move about the hospital or whether there might be testing or, I mean, all those things are being considered at various places right now.
Yeah, I don't have a lot to add to what Dr. Doran said. We are all getting into the details of those right now, working with our ethicists, legal, other hospital systems to determine exactly what qualifies for the religious and medical exemptions. They'll be very similar to our current exemptions we have for the flu vaccine, which many of us have mandated for, close to 10 years.
Doctors, if I may, Nathan Grieve, Channel 8. I have a question somewhat related to that. Is there a, at least early in this process, is there any indication of whether or not this is going to be a hard or a soft deadline? That is to say, is there going to be a requirement that the vaccination needs to be completed, or is the requirement mainly looking at whether a vaccination is planned?
For CHI Health, I'll say real quickly, our plan is to have all of our leaders vaccinated, fully vaccinated by October 1st, and all of our employees fully vaccinated by November 1st. And that's planning on being, that's going to be a firm date.
I would agree with Carrie in that, and that's one of the reasons that the deadline for vaccination for our employees will be November 1st. That allows them time to get both doses if they're getting one of the 2-shot vaccines.
And at Nebraska Medicine, our deadlines are October 1st for our leaders and October 8th for everybody else.
At Children's, we have the date of October 18th for leaders and November 1st for everyone else.
At Madonna, we're still working through our process and deadlines there, but very likely a November date.
November 1st for our hospital.
Another question that was submitted by Nathan asking why this decision is being made now rather than earlier in the vaccination process when community rates were lower.
So I'll lead that one off from Children. So as you heard, we've been talking as CMOs a long time, and we started talking about this requiring of vaccinations probably in May. And the idea was, well, when it's FDA approved, we'll feel much better about requiring. As the summer has drawn on and the approval from the FDA is moving in now to September, it was previously, we thought in August, we came together with the CEOs on July 30th, and all of us agreed that waiting isn't going to help our community. And therefore we waited as long as we could. And now we're going together with the vaccination.
We also see what's happening in the South, and we're running a little bit behind them in terms of starting a new surge. So we think this is the ideal time to give people the extra incentive to get vaccinated and hopefully prevent what's going on in some of the southern hospitals.
I think we're approaching a public health crisis with all of this. We've seen what's happened in the southern states. We've seen how rising numbers of the Delta variant for the coronavirus has increased hospitalizations, increased strain on the hospitals. And then also we've seen those parallels starting in Nebraska. Just 5 weeks ago, we had less than a handful of patients at Bryan Health, and now we exceed over 50. We've opened up 4 COVID units to take care of patients. We have patients waiting in our emergency room this morning, so for an inpatient bed. So the timing of vaccination, as everyone has said, we've been awaiting to find out that final approval, but we've seen hundreds of millions of doses of vaccine being administered. It's highly safe, it's very effective, and it's readily available. And we feel it's time, and this group has been united in saying it's time that we move forward in requiring vaccinations. We know it's the right thing to do. We know it's safe for our staff, our providers. We know it's safe for the community. We really need to push through this so we can really decrease this pandemic. The treatment of this virus is really a defense. It's prevention. We don't have great treatment options for this virus. We do have great prevention that's been developed, and we need to utilize that in the full extent. It's our best resource.
Are you guys worried? If I could just add one quick thing to that. So yeah, Dr. Trapp and everybody's talked about the impact on our patients. Certainly just one thing to stress also, we are seeing in other states, employees are increasingly calling in sick, and we're all seeing that ourselves. We've had a marked increase. We have to have our employees at work. They want to be at work taking care of these patients. So another really important reason, and I just want to say one other thing about this, 2 measures, I think we would all agree that have had the most dramatic impact on public health have been clean water and vaccination. And we all have vaccines in us right now that have had a dramatic impact on the health of our communities. And if you do a comparison of this with like influenza, which most of us mandate, it just another kind of justification for this. Influenza is far less severe than COVID. COVID is far more prevalent right now. The vaccine is safer or as safe and is more effective than the influenza vaccine. So it makes such sense right now. If we're going to require the influenza vaccine, we would also require the COVID vaccine. I think waiting has been the appropriate thing to do just to make sure for all of us that the vaccine is safe and effective. It's now proven. The FDA delays are fine details. Their paperwork, their shelf lives, storage requirements. The science is clear. Nobody's going to question the science of how effective and how safe these vaccines are.
Are you guys worried about staffing shortages moving forward? I know we're already seeing that, but are you worried that this decision will, cause people to quit?
So this is Harris Franklin, Nebraska Medicine. Absolutely. We've considered that in the process of our decisions. We recognize that there's a lot of vaccine hesitancy with some of the staff. We hope, however, that through the educational opportunities and empathy that we believe that we've employed in listening and giving people space to voice their concerns, and the efforts that we will make to help counsel, that we can convert a lot of this vaccine hesitancy to vaccine confidence. If you look at Houston Methodist, who was one of the first institutions that went through this with a vaccine mandate, their turnover was less than 0.5%. And so, yes, there's some risk, and we've all acknowledged that risk. We recognize that risk. We've discussed that in detail amongst our teams, but it's a risk that we are willing to take for all the reasons that have been stated by my colleagues on the panel here.
In addition, there will be valid exemptions. We all know that for religious and medical, there are valid exemptions. There was the question that was asked about, are we full or out of beds, requires some clarification, I guess. We have 145 beds at Children's Hospital and Medical Center. This morning, I had 132 patients in those 145 beds. So yes, I have additional beds. Do I have all the staff that can occupy the rest of those other 13 beds? We can get creative. We get very creative, and we do that on a daily basis. We have fluctuating. We can fluctuate 20 patients in a day, up or down. And if you have 2 days of just down, then you're 40 patients lower than you were 2 days ago. We can also go up those same 40 patients in 2 days. So we staff accordingly, and that's just what we do every day of the year. We're ready for a surge. And so we're a little concerned, yes, if some of the people want to leave our organization because of this new policy, and we hope that we can turn them into vaccination confident people, as Dr. Frankel stated.
We already require a number of vaccines. We require the measles, mumps, rubella, influenza vaccine, hepatitis vaccines. So again, I think we're hopeful through education processes that we can motivate our patients and motivate our staff and educate our staff to receive the vaccine. Again, we want to emphasize very safe vaccine, very effective vaccine, and we want to protect our staff. We want to protect their spouses. We want to protect their children, grandchildren. It's an important thing to do.
We announced CHI Health, real quick, I'm sorry, Bill. CHI Health announced last week that we had this number to call for folks to come in and to call, get any questions answered by a provider. I just wanted to say, we've had over 600 calls to that. People want to know, they want information. They've been very positive sort of calls. We've given over 500 vaccines in our clinics over this last week. Not that all of them were related to these calls, but we do think as people get more information, as they now better understand the safety, just like Dr. Frankel said, I think that the turnover, the number of employees who aren't going to get the vaccine and leave the organization is going to be incredibly small. People love what they do. They love their work. They love taking care of patients. And I think they're going to want to continue to take care of patients.
And I would add too, that just since this announcement was made this morning, I've had multiple text messages thanking us for making this decision for the care of our patients.
It's overall my sense that there will not be employees lost. I think, I have the confidence in them that they really are committed to our patients. They're committed to each other. And as I mentioned, there really is, as Dr. Bradford just mentioned, that there's a sense of relief that this is going to happen.
I just wanted to do a quick fact check on the institutions that already have a flu vaccine mandate. All I need, I guess, is just a thumbs up on who already has that in place. So 4 out of 5, 4 out of 6.
No, I'm sorry, I've lost my video. MSH does. The surgical hospital does.
Great, thank you.
I wanted to get your guys' opinion on a statement that was made this morning by Governor Pete Ricketts. He made it at the Federal Legislative Summit in Ashland, saying that kids are not at risk. This is a direct quote that he said, "Kids are not at risk. Kids don't get COVID." What is your response to that?
Well, the facts for the southern states right now with the Delta variant, which is very different than the native variant that we had 6 months ago and even before that the children's hospitals are having a lot more children being hospitalized than we have before. That's all I can go by, is that the facts are in the southern states right now. Children are being hospitalized both in the ICU as well as on the medical surgical floors.
But here in Nebraska, I mean, specifically since we're talking about a Nebraska governor, are kids in Nebraska getting COVID? Are they being hospitalized for it?
Yes, but not nearly the rates that are in the South. We still do have Delta. In fact, the Delta variant is the most prominent variant of COVID-19 right now in our community. And so we are seeing it.
Brian, we're actively preparing for a surge of potential increased pediatric patients, just in case Children's Hospital gets filled with RSV and COVID. We need to be prepared to help assist other communities with pediatric care, and that may include some level of higher levels of pediatric care and working in coordination with Children's and their pediatric pulmonologists to provide this care. So I think we're anticipating, as seen in the southern states, that we're going to see increased numbers of pediatric patients hospitalized.
Does a statement by the governor like that undermine your efforts to try and get people vaccinated and to be on the lookout for cases of COVID within their own families?
The pandemic is not over. And so we need to be very cognizant that it's around us. It is killing our neighbors. And so we do need to be aware of that fact. And so we really recommend masks, distancing, good hand hygiene. And so that's good for our community. In addition, we're going to have additional beds with the Hubbard Center for Children opening the end of this month. And that's also very good for our community.
I wanted to go back to some of the exemptions that would qualify someone to not get a COVID-19 vaccine. I saw in, you guys have talked about it, but I also saw in the press release that was sent out, like religious exemptions. I mean, where do we draw the line? Is someone going to be able to say, because I am a Christian, I believe that I should not have to take the vaccine? I mean, where are we drawing these lines on what we approve to be a valid exemption for a reason to not get the vaccine?
I'll be happy to respond to that question. I would say this, that we will address each case on a case-by-case basis. Clearly, general philosophical beliefs, socio-political beliefs will not qualify. But we will take each case on a case-by-case basis and address the merits of each individual request.
Yeah,
What are the,
as you've heard from Dr. Ward, we continue to noodle through these kind of topics, and similar to Nebraska Medicine, we will be taking every one of these exemptions on a case-by-case basis. We're one team at Children's, and we respect everyone's beliefs and values, and so we will have that conversation.
what happens if an employee still declines or refuses to get the vaccine? What will you guys do at that point?
So one of the questions about not getting the vaccine when it's recommended by so many organizations is that person the right fit for our culture? And maybe not. And they're allowed to make a choice. They can make that choice that they really don't want to work at Children's Hospital and Medical Center. And that's unfortunate, right? We want everybody to enjoy coming to work. And yet people make choices all the time.
Yeah, and I want to agree with what Chris said. I mean, I think that we all are in agreement that this is truly a requirement to get this, that we want to respect our religious, even some strongly held beliefs, and certainly diseases or reactions to vaccine or vaccine components that warrant a reasonable exemption. But for those who clearly do not refuse to get the vaccine, for CHI Health, this is a condition of employment. It is required of everyone who works here. We also have heard some good stories about hospitals that have required this have actually attracted a lot of employees because they want to be around people who have the same approach. They want to be around people who are vaccinated. They want to feel safer when they're at work, less likelihood of if someone has an asymptomatic disease and they're carrying it, they want to be less likely to get the disease. So we think that's a positive also.
When it comes down to it, we're ultimately responsible for the safety of our patients, and that's what it comes down to. Having a vaccinated staff care for those patients is without a doubt the safest way to accomplish that. It's almost getting to the point now where our patients are expecting to be cared for by a vaccinated staff. And I don't blame them. That's who I would want caring for me.
I would echo the comments that have been made heretofore. It is a condition for employment at Nebraska Medicine. We've also extended that requirement to our entire medical staff, whether they're employed or part of the community provider group. As Dr. Schmidt said, this is a way we can protect our patients. Equally as important, this is how we protect our staff. And I think you've heard the concerns raised by others that we have about the workforce in general and the workforce shortages specifically that not only affect us here in the Omaha and Lincoln metro communities, but across the country. And so we feel obligated to deliver on the brand promise of safety and protecting those that are able to deliver the type of care and answer to the expectation, as Dr. Schmidt said, that our patients and families have when they come to our facilities.
I would wholeheartedly agree with Dr. Frankel.
A question that Josh posed in the chat for everyone: do you anticipate, with the rise in cases we're seeing now, would we ever go back to where we were in the spring of 2020, where non-emergent or elective procedures and surgeries were postponed?
Well, I would say this, that, as part of any contingency planning for surges, whatever it may be due to, we will exercise whatever operational levers we have to pull to accommodate and be able to care for the patients that need us.
We have a pandemic team that's meeting on a regular basis to review caseloads, inpatient status, number of COVID patients, and what processes and things we need to do to care for those patients in the community and in greater Nebraska. So we'll make those decisions as appropriate to open up beds as we see the need meets.
Unlike in the adult centers, there's rarely an elective procedure that a child needs to have. It may be able to be deferred a little bit. However, most of those are rare. Even during the height of the pandemic, we ran a pretty busy OR. Now, some of the families decided they wanted to hold off. That was up to them rather than come to the hospital. And the part of our surge plan every day is to look at the cases that are coming in, whether they're medical or surgical, to make sure that we can handle them safely.
One other comment I want to make. Oh, I was going to make one other comment about. Oh, go ahead.
I was going to say, all of us, I believe, have surge plans. We would all like to not have to use them, but it just depends on what happens with the numbers.
Yeah, I was just going to emphasize about when we talk about elective surgeries, many of what are truly elective surgeries are outpatient procedures that don't require an inpatient bed. That's the most common type of elective surgery. These other surgeries that we're talking about that we consider elective, surgeries that can be delayed for 3 days or a week or 2 weeks, oftentimes are cancer resections, needed surgeries that patients have delayed. Some of these are cardiac catheterizations, bypass surgery. These are really needed surgeries for patients that they've already delayed sometimes by weeks or months, even from last year in some cases, that at times need to be done. So I think we have to be thoughtful about what types of cases we delay.
Circling back around to children, you mentioned previously that cases in children aren't as bad as what we're seeing elsewhere. But something that my colleague asked in the chat, and I wanted to touch base on as well. Obviously, those child numbers aren't as bad as they are elsewhere, but is there any particular reason why we're not seeing those child numbers? The pediatric cases haven't been released, to my knowledge, from any of the various hospitals or health departments. Is there any reason for that?
I guess I need a clarification of the question. Are you asking about here in Omaha or around the country?
I'm asking locally. We have not been able to find any numbers from any of our local facilities about child numbers. They haven't been released or anything, to my knowledge.
Well, it's not a secret. So I don't know where you found them last year at this time, or even 2 years ago. We haven't changed our processes. Now, when there was the public health emergency, we were every day we were sending our data, and maybe that's where you were seeing it on some of the state-funded websites. We continue to send data to the Knowledge Center. However, those websites are no longer being displayed since the public health emergency has been lifted.
I think that's a disadvantage for the public to not have access to the data dashboards with the state, and having the state put additional restrictions on what numbers are released to Nebraska.
I believe it's a disadvantage. I would like to see the dashboard back up and active.
Yeah, and I would add, data is powerful. Data can be educational. It certainly helps us gain line of sight to what's happening across the state. It helps us plan for what might be expected or be asked of us in Nebraska medicine. I will say this, that we have lobbied the governor's office through the chief medical officer to reinstate the statewide dashboard reporting. I'm also aware that there are a handful of senators that have sponsored a bill to bring back the dashboard reporting as well. So I think that it's fairly unanimous in our feelings that, data is powerful. Data helps us plan. And to have that data that we had under the PHE would be welcome once again.
And unless anyone here knows differently, we have heard from the governor and the state's chief medical officer that they are trying to get that up and going, in part due to some of the efforts from people on this call.
Julie's asking a follow-up question here about whether our health systems attorneys agree with the state's reasoning for not providing data. Maybe hard to answer without our legal folks here, but
yeah, I don't know.
May have to take that as a follow-up question then, perhaps. Any other questions from our reporter panel? I've been trying to get through the ones that come in through the chat, but if I've missed any by chance, please feel free to open your mic and ask here, or put them in the chat. I feel like we're getting close to having all of the questions from today answered from our reporters. So if there are any other questions, please feel free to speak them out loud or type them in the chat.
Yeah. Oh, I have a question. I'm Diamond Nunnally with Local 4 News. This is for CHI Health. I just wanted to know the specific percentage for how many people are vaccinated in your hospital. I didn't hear it.
Yeah, I think we're just along, what I said was we're along the same lines as everybody else. We think the number is probably 80, 85%. We don't look at the number daily. We think the numbers have changed probably significantly from when we last did our survey, as people are going in daily to get the vaccines.
This is Joseph with the Channel 8 in Lincoln. I'm wondering, this new vaccine requirement for staffers, does this apply to boosters as well? If a booster comes available that is recommended at the time, how will each of you kind of cross that bridge? Is that something that will take place on a case-by-case situation, or is it understood that when a booster is available, those will be required as well for staff?
So I'll say just real quickly, right now, there's been a joint statement from the FDA and the CDC about this, that they're not right now recommended. I think many of us suspect they will be. And much like influenza, there likely will be an annual shot that will not only boost immunity, but may be modified like the flu shot is to make sure we get the right strains. And just like we require the quote booster of the influenza, the new influenza vaccine every year, I wouldn't be surprised if we require that down the road. But too early to tell from my perspective. We're waiting on more science and information.
I had a quick question about when we're talking about your vaccination numbers, do you guys break those down based off of like, I know some of you had, I think Methodist had clarified like how many physicians were vaccinated, but do you guys break those numbers down based off of like doctors, nurses versus people who just kind of work within the facility that maybe don't, are not directly involved with patients?
We know everybody in which department who are vaccinated and who have not been vaccinated. Again, we're around 85% for our employees. For our providers, we're in excess of 95% of those employed by Brian. So for the independent providers, a little harder in Lincoln, just because some of them may have been vaccinated through CHI St. Elizabeth's. We do know who's been vaccinated through Brian, and we see numbers north of 70% for providers, but it could be way higher than that. We anticipate it's way higher than that based on CHI also vaccinating some of the providers in the community. So we're anticipating that providers are over 90%. So we are able to track that by department and have those conversations with individuals on a one-to-one basis when it's appropriate.
We have an extensive survey that we are getting ready to conduct that will give us better numbers. But I want to tell you, just ask in a few weeks, and the answer is going to be 100% for all of us, we hope.
Especially on November 2nd.
There you go.
Matt asked if there have been discussions with hospitals in other parts of the state and other cities such as Columbus or Norfolk.
Paul, this is Harris. Yes, many of us have reached out to our colleagues across the state. We recognize that each individual institution is in a different place in their journey. I would say that conceptually there's agreement, but from an operational standpoint, I think some of the institutions are not quite there yet. And time will tell as to whether or not they decide to follow suit.
Well, I think there was another question about pediatric beds.
Beat me to it, go ahead.
So this is my 201st Thursday to be in Omaha as a leader at the Children's Hospital. And we talk to every unit around to know what their pediatric capacity is. You heard Dr. Trapp talk about getting ready in the event that we're full. The pediatric hospitalists that work in Lincoln and cover those hospitals are employed through Children's and work very closely. So we work closely. We have a group out in Kearney. We work with Grand Island. And so we communicate a lot to make sure that we can care for the children in our community, with the emphasis that if they can receive high quality, safe care closer to home, they should.
Now, I want to say I'm really proud of these different healthcare entities and each of the chief medical officers on this line for the willingness to get together on a regular basis and to make a statement like this together. I think it speaks enormous amounts about the state of Nebraska, about physicians in general, providers, hospital systems, all working together for the good of the state and the good of our communities. So it's really a proud time to be a part of this group.
That's a great way to end things. Thank you to our chief medical officers and to members of the news media who joined us today. If you have any follow-up questions, please feel free to reach out directly to each health system's communications person. And thank you all for your time. Have a good rest of the day.
Thanks for attending.
Thank you.
Thank you.
Very much.
Thank you.